I don't go for it.
All right. Hello, everyone. I'm so excited to be here today. We are from the Trevor Project, and I'll let Sam go ahead and introduce themselves.
Hey y'all, my name is Sam Briton. I use the pronouns they and them, and I serve as the Vice President of Advocacy and Government Affairs for the Trevor Project. You'll learn a little bit more about us in the coming slides, but I just want to let you know that my role here is more on the advocacy, government affairs. How do we deal in activism and public policy in ways that save the lives of LGBTQ youth each and every day? That's my goal, that's what I do, and I'm excited to get to work with my amazing colleague, Keygan Miller, who I will turn it over to now.
And as Sam said, I'm Keygan Miller. I use they, them pronouns. I am an advocacy associate at the Trevor Project. I work mostly on school suicide prevention policy and mental health policy in K through 12 and higher education spaces. I also do a lot of other things around data collection and organizing of all of our information for the advocacy team. So a little bit more for those of you that aren't familiar with the Trevor Project. We are the world's largest suicide prevention and crisis intervention organization for LGBTQ young people. We run a 24/7 crisis lifeline, text, and chat. We also have some other awesome resources that we'll highlight throughout here, including our education department, our research, our Trevor Space, and our advocacy work. Again, we're doing anything we can to serve LGBTQ young people and make the world a better place for them. So the big question that we were really brought in to talk about today initially was, how has COVID-19 impacted LGBTQ youth? And so we're definitely going to talk about that today, but there's also, since this panel had been started to get planned, there's been a lot of other things happening in our world. We just want to take a moment to acknowledge that with all the Black Lives Matter movement and other things that are happening with our policy and government at the moment, there's a lot happening that is impacting mental health of everyone, in particular LGBTQ youth. So with that, we're going to kind of take this as a little bit more of expansive than we had originally considered around COVID-19. And we're going to talk about some of the intersections of that space of COVID, as well as of Black Lives Matter and a few other mental health issues that are going through. So, COVID-19, how has it really impacted LGBTQ youth? Several different ways. First of all, we can talk about physical distancing. Having that distance in the physical space means the potential loss of social connections that we know are a protective factor of LGBTQ youth. We know, for example, that having one supportive adult in a youth's life helps lower suicide risk by 40%. It's a huge deal. And so if I'm not at school where I might have a supportive teacher or professor, if I'm not going to an extracurricular activity such as a GSA or other alliance type groups, I'm not going to have that general connection. And as many of us who have been on Zoom meeting after Zoom meeting, there is something to be said about physical connection in a space and being in a space with someone as opposed to being in a virtual space. We also know that there's a lot of unintended negative consequences related to being in an environment that might not be supportive or maybe even abusive, particularly with LGBTQ youth whose parents aren't supportive of their identities. Being stuck in a house with those folks is not the best scenario. And usually students have the ability to get away and go to school or go to an extracurricular activity or do any of these other things that, because of COVID and the restrictions on physical distancing and spaces not being on lockdown and all of that, we know that youth aren't being able to get out of those situations and be around supportive folks instead. We know that LGBTQ folks there's an economic strain involved with this. We know that for especially our young adults, that unemployment concerns are already a thing for vulnerable populations, for folks of color, for LGBTQ folks. and the intersection thereof. And because of that, if we're, with all the jobs that are closing down, with all of the places that are shut up and not able to get employment started, if people don't have a safety net already in place, that makes them even more stressed and can cause some mental health issues in that space. We also want to point out housing instability with LGBTQ youth being disproportionately impacted. Again, we know that LGBTQ youth are being kicked out of their homes for coming out as LGBTQ. We know that folks can't always stay in some of those spaces, as we mentioned before, especially if they're abusive environments. This is particularly interesting around college-age youth who, at the height of the COVID crisis, were getting pushed out of dorm rooms and other campus housing for safety purposes of COVID-related problems, but had nowhere else to go because of the impact of their families. Again, that could be something as like not having supportive parents that you can go home to. It could also be a factor outside of LGBTQ issues of if you're living on campus, your family may or may not have had the economic support to be able to have you living with them. So that can cause additional strain and stress. And of course, we have increased anxiety. We know that it's harder if we're in unsupportive spaces to seek any type of medical attention, physical or mental. Health of any kind. We know that there's a lot of uncertainty about the future and what it holds, what's going to happen with COVID, what's going to happen, in this space of economic downturn, what's going to happen if you're in school, what's going to happen with schooling. Like, am I going to be held to the same standards and requirements for my degree program? Am I going to be, if I'm just graduating, what does that look like for my economic purposes? Again, there's just all of this extra uncertainty about the future going forward. And then to top it off, we end up now in this space where not only are we worrying about COVID, but because we're so focused on social media in this space, because that is our way of connectedness at the moment, that we're getting these, we're getting violent imagery on the news and social media being pushed at us. And so, even within that, in a space where we might be able to find refuge during the COVID crisis, where we're seeing these images that are negative to the community. Again, highlighting the intersectionality of people of color and LGBTQ folks, where that community crosses over. This is going to be even more impactful in that space. Now, mind you, we do want to point out that there are moments of hope embedded in here. There's activism happening all around us. There is, movements springing up from everywhere, and there's people speaking out, and that's also important. So when we're looking at social media, we have to look at its impacts, both negative and positive, altogether. So I'm going to kick it over to Sam to talk a little bit about what Trevor is doing to create community during this physical distancing time.
Thank you, Keygan, and mad props. That was a great description of what we're addressing. So we use the words, oops, can you go one slide back? There we go. We use the words physical distancing rather than social distancing, because hopefully socially we're all close together, as Keygan mentioned, though that can bring up some challenges. But let's say that you have friends or yourself who may be experiencing all of those increased anxiety, all of those challenges that Keygan just walked through, and you need to know where to go and who can help. First off, you should always know that you can call the Trevor Project. We have been around for more than 20 years. Launched in 1998, Ellen DeGeneres had just come out and did a little opening foray into a documentary about a boy named Trevor who had a hard time. And we founded the Lifeline to make sure, well, I did, let's be very clear, I was not back there, but they founded the Lifeline back then to make sure that LGBTQ youth had someone to call. And I'm gonna be honest, my friends, people are calling more than they used to. We are serving more LGBTQ youth than we ever have before. And that's because folks know how to get to us in a variety of different ways. First off, the Lifeline, 866-488-7386. If you're like me, you're never going to remember that. Don't worry. You can go to the trevorproject.org/help and it will tell you the phone number. So to my fellow phone number, challenged remembering friends, I got you. Second, next slide, please. I do want to talk to the millennial Gen Z folks who maybe talking on the phone isn't the easiest way to get a hold. We're in COVID. You may be a simple door away from family and friends who are listening in on all of your conversations. Probably not too easy to do calculus when, they're sitting right there, but also may really be hard in a crisis situation. So text and chat are there as ways of nonverbal communication with the same services that you should expect from Trevor Project, life-saving services 24/7, 365, whenever you need us. So you can text START to 678-678, or you can, again, as I mentioned before, go to thetrevorproject.org/help, nice and simple, and you'll be able to find access to these services. Know that if you're talking about these services to others, it's really important to mention these text and chat, because I'm going to give a personal example, right? So as a non-cisgender person, as a gender fluid person, when I'm emotional, my voice may not sound like I want it to sound. It may not align with the identity that I'm trying to portray and in an expression, right? So it's really comforting to know that in a time of crisis, I don't have to be thinking about my voice and how it sounds. I can be talking with a person about what I'm going through rather than how I sound. So just know that it's really important to offer those services. That's why the National Suicide Prevention Lifeline and Crisis Text Line exist, right? Different services for different populations needing different things at different times. So many difference. Okay, so next slide, please, Keygan. Let's say you're not in crisis, but you're still in COVID home, right? Or you're watching all of these protests. You're trying to figure out what you can do. So Trevor Space is this social media space where LGBTQ individuals from all over the world, it's our only international program actually. So all over the world, LGBTQ youth get together and just talk, peer-to-peer social support. Now to be clear, you shouldn't be going to trevorspace.org if you're in crisis. You should be going to our crisis services that I've already mentioned. But if you're not in crisis, and let's say it's your parents might have not known what you were talking about when you talked about gender identity. And that may not have put you in crisis, but you may be wondering what other LGBTQ people or your peers have mentioned in this work and how they've done it with their parents. So it's not a crisis moment necessarily, it's a peer-to-peer social support space. And Trevor Space has thousands upon thousands of people joining every single month, and I hope that you'll offer it. The cute joke that you can use to entertain your friends with it is, think of it like Facebook or MySpace, which you probably don't remember, for LGBTQ people, but we don't sell your data to the Russians. It's a pretty great system and a pretty great way for us to create community. We talked about the question, how do we create community in physical distancing? Well, social media spaces specifically targeted to specific populations like the trevorspace.org can be really helpful. Awesome. Next slide, please. But the work doesn't stop there. We have crisis services, we have Trevor Space, we have work that we're doing in education and advocacy and research. And I wanted to make sure that you knew about some of that work so that way you could either learn from them, share them, or be a part of them. So let's get started right away. First off is Pride Everywhere, a campaign specifically for a COVID Pride. When you see most pride parades canceled, you may be thinking that that's not that big of a deal, right? Like, we're all dealing with a lot of social differences. How can a pride parade really matter that much? To many individuals, this may be the very first time that they're really seeing their community in mass. Let's give an example. If you can't go to a gay bar or a gay club, the only time you may actually see your community is once a year at a huge pride parade, right? That's the major time where you will feel like you're not alone. So to make sure people recognize that they didn't have to feel alone, we have the Pride Everywhere campaign. So you can look it up, hashtag Pride Everywhere, look it up. You can do a great, what's pride look like for you at home or where you are. We also have to recognize though that Pride was a riot 50 years ago. And so when we started this Pride Everywhere campaign, we moved. We pivoted to, as we saw where the movement and the folks who were contacting us moved, we recognized that the time was now to make sure that we were actively working in racial justice. And so we have translated a lot of our Pride Everywhere work to making sure that that as it came from a racial justice lens, it is making sure that Pride Everywhere is also recognizing that it's not about the rainbows, it's about justice. And that's really, really important. You may be wondering what we're doing in terms of COVID work. So we have had surges of contacts more than twice our normal call rates, thanks to COVID and the trapped feeling that it has brought in some people. I'm also really proud to say we've never had more volunteers joining than now. So let's say you have an interest in serving as a digital or a text volunteer, we need you. We are more than welcome to welcome you with open arms. There's a really important training process that you have to go through to make sure that you're able to best serve individuals. But if that sounds like something of interest to you, know that you'll be joining a wave of volunteers in response to a wave of volume. So really, really glad to be about that. We've also been advocating specifically for LGBTQ youth mental health resources. You'll be able to see, and Keygan can put it up in the chat box, the actual resources that we have specifically when it comes to COVID. We know that mental health is changing for LGBTQ youth, and we wanted to have a resource. So we've provided resources there specifically. So you'll able to see those. However, again, you're like, oh my goodness, Sam, stop. No, I will not. However, we've also looked into what is it take for a lot of people who are making this movement towards social justice in ways that are related to protest and taking action. We have a whole blog post specifically about this kind of work, and I wanted to make sure that you could access it. Thank you so much, Keygan. So this blog post is all about making sure that you have what is needed to be safe while still doing what is important to you. So again, check in with yourself, know the feelings that you're having, also check in with your health. Make sure that when you are, taking action, it's not coming at a cost of your mental health or your health in a way that you're not comfortable with. Again, we're all taking risks every single day, but let's manage those risks and let's figure out ways to, by community, make sure that we are safe. That moves us into what I would call will be our next slide, which is all about LGBTQ youth mental health from a Black perspective. So supporting Black LGBTQ youth mental health. First off, I need to start with the idea that you need to recognize the common feelings that you're feeling. The scared nature, the how do I process what I'm feeling, the nerves about talking about racial issues when you may be a person of white identity, right? Like, these are all common feelings that you need to be having, and you need to recognize that you're not the only one going through them. It's also really important to feel the emotions that you're feeling without judgment. I love all the quotes that have been going around about supporting our Black Lives Matter campaigns in the Black community, which has been, it's gonna be uncomfortable for you at times. You might cry, you might feel bad. You have to understand that those feelings should come without judgment, that feelings are feelings, and how we act on them is what is going to be really, really important. So center yourself in the idea that you are going to have feelings that other people are feeling, and you need to allow, you need to, funny bone. Okay, well, that's fun. You need to allow yourself to feel those emotions. You also should be centering the voices of Black experience and Black voices. So we need to be very, very clear. This blog post that you're reading, which has been shared 3 million times now, is just really making all kinds of impact from our website, was written from a perspective of our head of crisis services, a Black woman. We center the voices that need to be shared right now, and we need to recognize that I need to be very clear. I am saying that as a white person. I need to be centering the voices of people of color, and I hope that this resource helps do that for you in this work. As Keygan mentioned, and I wanted us to say it yet again, it is totally okay to take a break from the news and social media. I need to be clear. I've literally had nights where I couldn't sleep in this movement because I was watching the news and I was seeing that people were, having violent protests, and it was really hard for me. So I want you to know that taking a break from the news is absolutely okay, and that social media is really valuable in times, but also can cause a lot of harm. So breaks are okay. And last but not least, and we're about to get to the homework. Yes, there's homework. You thought you were done. We need to pivot to action. Feel the feelings, allow them without judgment, center the voices that you need to be listening to, take breaks as needed, and then do something about it. It is not enough to think. It is something that we must do. That action can take so many different forms. Go to this blog post that again will be shared, and recognize that there's a lot of different actions that can be done from the home, from the streets, from your couch, right? Like figure out what works for you in a healthy way. And last but not least, we're going to go to some of those actions that you can take between Trevor Project and Active Minds. Keygan. Awesome. Do you want to take this one, Keygan?
Sure.
Great.
So for folks, particularly at home right now, due to COVID, one of the biggest things is how do I access a lot of resources? And as you know, folks who are pushing that schools are helping with mental health and suicide prevention across the board, the biggest question that I always have for people is, do you know if your school has mental health resources and crisis intervention services listed publicly somewhere? So that way, if I am a student who's looking for resources, if I am a student who's in crisis, I don't have to look much further than, a couple of pages into my school's website. This is particularly the case for colleges and universities, but it doesn't matter. If you are going to school for cosmetology, I don't care. Does your school have these resources listed on their website someplace so that young people in crisis can easily access the resources around them? And then, if you want to take that up the next notch, is do these resources that are listed or that you're recommending be listed, do they serve LGBTQ young people, people of color, and other high-risk populations? Again, making sure that people are able to get connected into resources that are directly going to impact the way that they feel and are able to deal with mental health in their space. So it's really quick. You can just Google wherever you go to school, went to school, whatever it might be. See if it exists on their site. And the first thing is knowing that, and then the second is advocating to make sure that those resources are there someplace. Really quick, really easy, big way to impact people, especially in a time when our computer screen is our outlet to the rest of the world. So now, speaking of ideas for action, we're going to kind of move into a space where you can ask us any questions that you have about anything that we've talked about today or anything outside of that is relevant to this space. But I also am kind of curious to know, what have you been doing in your space to create a community during this physical distancing time? So if you would like, you can put information in the chat. You can ask questions in the Q&A or in the chat section. And then the other option is you can hit the raise your hand button, and we can have you unmute one at a time in that space as well. And don't be
while those questions are being formed and coming in, we do have a couple of questions from folks so far. So the first is kind of logistics. What are the hours of operation for Trevor Chat?
24/7.
Great.
It's always there. If you're awake, we're awake. We got you.
Awesome. And I think you all kind of touched on this a little bit, seeing an increased volume in calls, but we have a question about if y'all know from your data, you've been seeing an increase in young people struggling, particularly with suicidal ideation or intention in this COVID kind of period.
Sure. So I'll take the first pass at that, and Keygan, feel free to add to it. So it's really important to recognize that we as a crisis intervention service are kind of considered upstream. So we're actually considered like some of the first steps that you'll actually have in response before an actual attempt in that kind of way. So I think that's really, really important to recognize, is that we don't actually have data. You may have been seeing that, for example, a quarter, and this is very important, a quarter of COVID deaths have been Black bodies. That is really, really horrific to think about, that kind of unequal treatment. But we don't know how many people have died by suicide, for example, that are LGBTQ, because we don't ask those questions. So yes, we've seen an increase. As I mentioned, we've had, we're at the highest level we've ever been, and we are have at times been surging to more than twice our normal rate. It's also really important to recognize that it's being there. So to answer the question specifically, are they more quote unquote at high risk, AKA having intense suicidal ideation? We have had more individuals at high risk, which is different than many of the other lifelines. So it's really interesting. You may be seeing in other places the idea of, we should open everything up because this is putting people at risk. And they've been doing this built on the idea of volume, but volume is only one aspect. It's intensity along with volume. You have to have both to actually kind of know where the effects are. So I just wanted to kind of also frame it in that way of, yes, we're seeing increased volume. Yes, we're seeing increased intensity, but that also recognizes that we don't actually know the whole picture because we don't have a health statistics system that really takes all that into account.
Thanks for that nuance. That's really helpful, I think, in framing the kind of work y'all do and kind of that upstream approach in the field. So this is another one, and I wonder if we can broaden it a little bit. The person has asked about kind of the different experiences of mental health and LGBTQ identities in Black folks in particular. So I think especially right now, talking a lot about like the vicarious trauma and kind of emotional burden, I think I might say, that is not like a dramatization. I'm wondering if you all feel, and I know this isn't necessarily your field, comfortable kind of talking a little bit about that.
Keygan, would you want to take the first pass at this one, or do you want me to?
Go ahead. I am actually looking up our white paper to post in the...
Perfect. I was hoping you would do that. That's great. Okay, so we'll have a resource available. Welcome to, we're the nerds, right? Welcome to Trevor Project. My name is Sam. I'm probably a nerd. Keygan, way more of a nerd. So we have some resources for you. So as I said, centering Black voices, you should use the resources over my experiences, but I want to provide a little bit of what we're hearing. We have been hearing from youth of color for more than 20 years, right? So we know some of the effects that are happening. We also have been posting a lot about the recognition that because of the minority stress model, the idea that because you're a minority community, you are under, as Robyn literally just mentioned, right? Like this emotional burden that is compounding. That does not necessarily mean that it is always compounding in the same way. So to be in a community, but to see a lot of resources for your community can help de-escalate that experience, AKA why Trevor Project exists. We are trying to de-escalate specific services for LGBTQ youth. Now, because LGBTQ youth are from a variety of races and a variety of identities, we try our best to make sure that we are having volunteers and resources available directly. That doesn't mean it's always easy. I'm going to call Trevor Project out because I think it's important to be vulnerable with you all. We are entirely rethinking how we do crisis intervention when it comes to actually calling in emergency departments. So you may not know this, but for many, actually, no, most, if not all, lifelines, if a person has direct lethal access means and has told us their plan for suicide, we need to start contacting emergency services to try to help save a life. And I'm sure you can all imagine that as a Black American, having the police show up when you are in a moment of crisis is not a good experience for many Black Americans. And the Trevor Project has had to wrestle with this for a long time. I'm proud to say that we're thinking honestly about what are the mobile crisis units that we could try to support. What are the ways that we could get mental health professionals instead of the police to show up? So it doesn't answer your question perfectly. And I hope it kind of showed a little bit into behind the curtain of how we're thinking about it. But know that we're always open to further ideas. I think, as Keygan asked, right, if you have ideas of how you're building community in this way that you think we could be a part of, let us know, because we're not serving LGBTQ children. We're serving everyone, and that happens to include LGBTQ youth who happen to be inclusive of a variety of races, including Black youth, which we need to be centered. Okay, hopefully that answered the question. Sorry, Keygan, hopefully that was most of it.
That was perfect. And I put in the chat box our white paper on suicide trends amongst LGBTQ youth of color. So that way you can see that at your leisure.
Great. That was great. That was a great answer. So we have another kind of logistical question. Somebody is wondering if there are volunteer opportunities for folks under 18 years old with the Trevor Project.
Keygan, this is all you.
Right. The unfortunate answer to that is at this moment, not directly. I will say that there's always the opportunity for folks to do indirect volunteering for Trevor by always posting all of the things that, about Trevor, keeping up with our news, posting those things on social media, telling your friends, like all of that sort of space is definitely available to anyone of any age. That is something that has been on my mind recently and is in process of being thought through of how that would work exactly. But the solid answer is unfortunately no at this moment.
Great. And it looks like questions are slowing down a little bit. So just a reminder, if you have a question, you can post in the Q&A. You can raise your hand, which you can see on the bottom bar, and you can post in chat. So it looks like we have a question in chat. Somebody's describing working in rural communities, especially both watching kind of the rallies around Black Lives Matter, and also knowing about the pushback that local schools and folks have been facing when talking about LGBTQ folks. So I don't know that there's as much a question there, but they're, I think, looking for resources or thoughts on organizing in a rural setting.
Yeah, so the interesting part about our Trevor advocacy team is all of us come from actually rural communities and now live in bigger cities. But and so definitely near and dear to our hearts on that space. It is hard when you don't have direct LGBTQ resources in spaces, right? So in rural communities, we recognize it's not like an urban center that has an LGBTQ community center or a or a list of 20 LGBTQ friendly physicians or anything like that. So I think the best thing that we can do is continue to educate the people that are there, right? Is we reach out to those medical professionals, mental health professionals. We reach out to folks who are providing a variety of social services to make sure that they're educated on what LGBTQ issues are. And we advocate for policy that are inclusive of LGBTQ folks. And we push back against the idea that LGBTQ folks aren't from around here, right? Because I know that that's a constant thing that comes back. There are some really amazing folks doing suicide prevention work, particularly around farming communities, which I find fascinating. And that they've never even thought of the concepts of working on LGBTQ issues that are intertwined. So really looking at what mental health services currently exist in your area and then trying to educate and push into those spaces can sometimes be a better response than trying to come in with a whole new LGBTQ movement space almost. Again, just based on what exists as far as resources are concerned. So that's a tough one for sure.
Well said, Keygan. I think the only thing I would add is we know that we're served, because I have to think of our data, right? Like we know we're serving nearly half of our individuals are considered rural, right? Like they're telling us that they're at least in locations that are more rural. So like, it's not that this is a rarity, right? This is common. And when getting back to our earlier feeling like of common feelings, it's really important that you, when you contact a crisis line, are hearing a voice that understands that effort. And so I want to be very clear, right? Like the advocacy work that is being done, when you see those, when you see the protests, but you're not sure why it's not happening in your city specifically, like why this is a little bit different, know that that is a very common feeling, that you should feel comfortable knowing that that's common, and that together we're going to be able to address some of those things, because we say this very clearly in our advocacy team, right? The kid in California matters just as much as the kid in Kansas, and neither of you are kids, but we'll call it the young person. It sounds better alliteratively, right? Like, but the point being, let's make sure that no state is left behind. I think that's I just want to make sure that it's a very clear statement from Trevor Project.
Yeah, and I think the data you're talking about, knowing that there's service utilization everywhere and a lot more communities are considered rural than we might imagine. I'm somebody who's lived in the Northeast my whole life, and there's a lot more ruralness of the United States than I think we imagine. But also, Crisis Text Line has a really great data visualization kind of platform where you can see, the amount of people texting in at like what time from what states, and it's all anonymous and kind of taken together. But it's really interesting to see that some of the states with the most need, or the most pressing need, or the most people texting in are, Wisconsin and North Dakota and things where you might not imagine proportionally has the same kind of impact. But I think it shows that our work is really, really important everywhere, not just the places where we imagine this work happening. Great. So I'm going to combine a couple of questions that have more Trevor Project focuses. So people are interested in learning more about opportunities to volunteer with the Trevor Project as college students or over the age of 18. They're interested if you all have like graphics or templates or stats that are easily kind of shared. And they're interested if you have speakers or other kind of events people can do, or documentaries or so on.
Absolutely. So let's start with volunteering. So if you are over the age of 18, we have a couple of different ways that you can volunteer at the Trevor Project. We do have folks who work our digital and chat services that are volunteers. That's a little bit more of a time commitment. So if you have several hours a week that you wish to put forward, that's a good opportunity. Our advocacy team also has the opportunity for volunteering with a little bit less time constraint, and it's not so specific. You can do it at 3 a.m. if you want. It's a lot of research-based work and looking at what kind of policies exist in the world and really creating the foundation of our work. So different opportunities depending on what your space is, whether it's wanting to directly work on the lines or do some of the behind the scenes to make life a little bit better for our LGBTQ young folks. There's definitely space for that. You go to our website, there's a volunteer section, and you can fill out the form and tell and it'll give you a little bit more description of that. And you can mark what you're interested in and you go from there. As far as things that you can share out, right now, first of all, our Pride Everywhere campaign has a lot of templates and things for like social media posts. So see that, share that often. And then you can always reach out to our advocacy team, and I'm sure we can get you our information for more specific needs regarding graphics, templates, etc. as well. And then what was the other piece of that? There was
about like speakers or programs or.
Yes, absolutely. That is also a thing that we do. And depending on what you're looking for, whether it's, advocacy related, whether it's crisis services related, whether it's training related, any of those things, the best, I would say, do our info at, right, Trevor? Was that what you'd say, Sam?
Yeah, I would say probably go to advocacy@thetrevorproject.org, because the info could go in a lot of different directions. So advocacy@thetrevorproject.org. And Robyn, I'm gonna take this as a moment. I just realized I know Active Minds has a really active speaker list and support system. Let's take that as an action item in the middle of this event. That's a better way that Active Minds and Trevor Project can coordinate. Let's make sure that that all does. So everyone, you just saw that in real time. Yay for collaboration. So
absolutely, and webinars are totally a thing, and they're a whole you can get a whole lot of people on for a lot less money than it would normally cost anything other kind of event, right? That's the beauty of, let's take COVID at its advantages. Yeah.
Amen.
And actually, just to piggyback on that, I'm going to share in the chat a link to Active Minds. I think, is that a link? Actually, Zoe, if you don't mind going and just grabbing that webpage and making sure it actually links, that'd be great in the chat. But we have a question here pertaining to college mental health and initiatives people should undertake in the new year, especially imagining that a lot of it will be virtual. So I wanted to point out that Active Minds has a resource hub. It's activeminds.org/COVID, where we've been sharing for the past several months. We've had probably 2 webinars or discussions a week that we've recorded about, for students, different parts of what they can do, whether it be programming or hosting meetings, or a lot of chapters are doing pen pal programs and gift trees and things to kind of make people feel like part of a community. Also with students in mind and campus professionals, advocacy and different kind of issues we've seen being raised in the last spring semester to prepare for the coming fall semester. So about grading, about attendance, about kind of flexibility, all of those different kind of topics that we saw pop up. And we also do have speakers, like you all mentioned, that are also doing remote engagements, and they cover all, I'm gonna say without an asterisk, all the topics. So, everything from, experiences of depression and anxiety and suicide and personality disorders and ADHD, and a lot of them have intersecting identities with their race and language and LGBTQ identity. So it's a really, really fantastic resource. And like we said, we're still actively booking engagements in person and not in person, and with kind of backup and collateral plans for the summer and the fall. So yep, so the link has been posted to our COVID hub, which will bring you to the rest of the places on our website also. Did you all want to answer also that question about mental health initiatives in the coming year?
Yeah, so I think one of the biggest things is making sure that the students have that ability to get connected with their peers, right? We know anyone who's worked in campus life and housing knows immediately that getting freshmen especially involved on campus and in activities is one of the best ways to keep them mentally healthy and active in college. And so finding unique ways to make that still happen in a virtual world is going to be super important. So whether it's, ensuring that student groups have the ability to have their weekly meetings via Zoom, or making sure that your various support groups have a platform in which to meet. Any of those spaces that we would usually meet in a physical capacity on campus to bring in student engagement, we have to find a way to do that virtually, because otherwise we're going to lose that community space, and you're then going to lose students who are actively participating in their college community. And then we know that affects academics, it affects mental health, and all these other spaces along the way. So really focusing in on making sure that students have a platform to do what students do best, and that's gather and support one another.
I'll add, perfect, Keygan. I'll add to that other actions that can be taken, for example, are you need to be driving to public resources. Those questions that we asked earlier of like, what are your public mental health resources? It cannot just fall on Active Minds. I love y'all, former Active Minds, member, and we did a lot, but we can't do it all, right? So your university should be having public resources, including even just listing the National Suicide Prevention Lifeline and Trevor Project and crisis text line. Like, that's the lowest bar, and they should be able to do that. So having a week where that's one of your activities, right, to kind of call on your university to do that. Making a list of professors who maybe teach, young freshman classes, and having them at the bottom of their email address when they have all of those other really important things that they're listing, having them list the link to a mental health resource page of your university, which you've now created because your university has it, right? Like, these are activities that can kind of build on each other to get those resources as kind of a normal process. Don't make it the idea that because we're coming back in a crisis, this might be the time that we only would need these resources. We need these resources every day. Suicide is the second leading cause of death among young individuals, and that's something we can address, right? With this work, with your active participation, you're able to save those lives. So those would be the only things I would add, right? Like, have a direct, I would love you all to just all email Keygan being like, OMG, my university totally does already have a resource, so we can celebrate with you. And then when they do, have that be shared. Have that be something that becomes a normal part of your university conversation is, hey, welcome to campus. Here's the cafeteria, food, here's the mental health resources in case you ever need them. And here's, the medical center, right? These are all normal things that people might need as resources, and we want you to have them. Maybe your cafeteria is good. Mine was not, just letting you know. So
yeah, and I'll say a lot of our students on campus, we're leading a lot of those projects, putting crisis numbers on the back of IDs, encouraging faculty members to write a section on mental health services in their syllabus, right, where they put, if you're struggling with this class, go here. If you're struggling with your housing, go here. Your financial aid, if you're struggling with your mental health, go here. And a lot of our chapters have done really, really fantastic work, especially in the spring when everything was kind of chaotic for a minute, really sharing the resources and elevating, their campus counseling center might not have a ton of Instagram followers if they have an Instagram, but your chapter probably reaches a decent amount of people. So sharing those things and making sure folks are aware of the resources that are out there has been a really, really powerful way that students have been able to elevate the work their universities are doing well and push universities to be doing more.
Also, support your faculty and staff who are doing good work and elevate them and their successes when people are doing the things you're asking them to. A lot of these folks, this is coming from me being a teacher previously, a lot of those folks have had to pivot really hard, really fast on some of their own work. And so when they are doing something well, pointing that out as an exemplar for others is always a good plan too.
Definitely. And we love to hear about all the things, even if you're not struggling and your university's doing great. And we love to hear about that so we can share with other folks looking for examples of what they can be doing, both big and small. So please feel free to email me and us, all of us. But I'll just plug one other resource while we're here. So for students, we have a student Slack network. So if you're not familiar with Slack, it's kind of this online co-working chat room / forum / like kind of community space. So we've got a little over 1,000 of our chapter leaders in that network. And we've actually just been able to expand it to all students. So it's usually a chapter member exclusive kind of perk, but one of our partners, Just Period, has allowed us to expand it to all students at this point. And that's where we're sharing a lot of the, daily wins. We're sharing a lot of self-care tips and different things we're seeing about how schools can be doing XYZ or how students are supporting each other. So if you go to activeminds.org/Slack, like slacking, you'll get the information and be able to sign up there.
say I see in the chat they've asked if the slideshow is going to be shared with participants. I assume that this is being recorded, so I'm assuming that this is going to get shared out for sure.
Yep. So check back on the Active Minds website probably early next week, and we should have that posted. Also in that COVID hub, since right now kind of all of our special events are being directed through there. So you can find the recording there, and I think we'll also be sharing probably on social when that's up and running, up and ready. Unless I missed any questions, I think that's all of them. If I did miss any, please chat so I can see them again. But I think it's probably a decent time to be wrapping up. Is there anything? Somebody's wondering how they can kind of stay connected with you all and us. And I'll also say if you email us at chapters@activeminds.org, we can talk with you all and see where you want people directed. Or if you want to share in the chat how to be in touch, we can do that too.
Yeah, I'm sharing the advocacy at thetrevorproject.org just so it's there for visual purposes right there.
Great, and a good place to get us is chapters@activeminds.org, which I'll type after I talk because I can't do both. So we already got it. But are there any parting words or thoughts that you want to leave people with?
Oh, sorry, I'm trying to hit, enter, there we go. Okay, I was trying to get it to all attendees too, sorry. So I guess parting words are, I'm really grateful, Robyn and Zoe and others, but I'm grateful for this collaboration. I've said it to, Alice, the CEO of Active Minds for many years. I'm really glad that Active Minds and Trevor Project are so clearly collaborating. And here's why. It's in a time of crisis, Keygan and I are trying to respond, right? We're trying to create resources and abilities to help make the world a better place for those whom we're trying to serve. But you, as Active Mind chapters, are really, what we like to say, like, you're the people with the actual zip codes, right? Like, you're the people on the ground who are able to just be the person to listen, to talk, to raise the conversation of mental health. So, from a person who got to do that in the past and now is more of a, my job is more, press articles and Congress, right? Like, I'm grateful for the great collaboration, and I'm hoping this is the beginning of this is the middle of many, many future conversations. If anyone is ever wondering how we can better collaborate, tell us, right? Like, we want to learn. If there was one thing you heard from me before, it was right to center the experiences of Black individuals in this time of great debate and great conversation, right? So center those voices, and then yet hold accountable those whom you can. And I am giving you all the power. Hold me accountable. Let Trevor Project be a group that you want to work with, and that's how I'll offer it. Keygan, turn it over to you.
I don't know that I can say anything better than that, but know that we are working to do the best we can, and we look forward to working with all of you in making this better, this world a better place for all of us and all of our mental health. So thank you so much for having us, Robyn. It's been amazing.
Yeah, and I'll echo too. We definitely love this partnership, and are also trying really hard to respond to all the different needs and thoughts and ideas of our students. So please be in touch. You're in touch with me quite a lot, maybe too much if you're a chapter leader, but please continue to be in touch. And it's June 10th, and I haven't gotten a chance to say this to anyone else yet due to the circumstances, but happy Pride.
Yes.
And yeah, so thanks so much for joining us today. Like I said, circle back on the Active Minds website a little later in the week or next week to see this recording, and we'll be talking with you all soon.
Thank you.
Yeah, have a great rest of your day.